Hello, my name is Don Williams, and I'm honored to be asked to talk to you tonight about dementia and Alzheimer's disease. For me, this illness became personal when on Thursday, June the 9th, 2016, at 5:30 that afternoon, my cell phone rang and a doctor from the UAB Kirkland Clinic read these words. After studying the most recent uh, MRI from the one that we took of your mother 3 years ago, I see significant shrinkage of the brain. The diagnosis is dementia due to Alzheimer's disease. On that occasion, this disease became very personal, and mom would live and die of it ultimately 37 months later on July the 13th, 2019. There's a lot of things about dementia that we need to talk about. There's a lot of misconceptions about it as well, and I'd like for us to address that at the very beginning as we introduce this idea. Some people have the idea that Alzheimer's is of German origin and means demented or out of mind. That's not true at all. It was in 1901 that Dr. Alois Alzheimer, a neurologist, pathologist, and psychiatrist, began to treat a woman there who had mind issues. When she died a year later, he took her brain and began to examine it. It was like Swiss cheese. The cells of the brain were tied up in knots like a rope. It contained amyloid and tau plaque. In 1907, after uh, telling others of his findings, it was referred to as Alzheimer's disease. Another misconception is that there will not be too many people that will deal with this. Yet Dr. David Hutchins has said that in any given audience, in any given time, 53%, more than half of the people in that audience, will one day either themselves develop dementia or have someone that they know and love develop dementia. Another misconception suggests the idea that if a family member has a form of dementia, whether it be Alzheimer's or others, that there's going to be a 50% chance that you're going to develop that disease as well. That's not the case. But if it is in your family's history, there is a more likely chance that it will be there as opposed to those who do not have that within their family history. Three components enter into a family having some kind of dementia, whether it's Alzheimer's or other. Number one, the family history. Are there family members who have some type of dementia in their life? Number two, the age that that family member acquired, whether Alzheimer's or other forms of dementia. The younger they were when that dementia was found, the more susceptible a family member will be in that regard. And then, thirdly, how close were you to that family member who has dementia or Alzheimer's? Is it a parent, a sibling, or is it a third cousin? All that enters into the idea of whether or not dementia is going to be a part of your life as well. Head trauma certainly is a leading cause for dementia among young adults. Each year, 165,000 end up in the hospital due to head injuries, whether it be because of sports or car or motorcycle crashes. Post concussions that are repeated can cause apathy and forgetfulness. And emergency rooms have shown a great deal of traumatic brain injuries, which can cause, in time to come, dementia. The fact is that at least 13% of all people 65 and older will one day develop Alzheimer's disease, which is the leading form of dementia. Every 68 seconds, someone in America develops Alzheimer's disease. It's been estimated that by the year 2050, there will be 16 billion people with Alzheimer's disease, and that then, on that occasion, it'll be every 33 seconds that somebody will develop Alzheimer's disease. With dementia, there is a direct connection to the loss of neurons in the brain with this disease. These nerve cells are like computer chips within the brain. They send brain signals to each other and short circuit those cells so that they cannot work together. Some say that you and I have as many as 100 billion nerve cells within our brain. As we get older, in our late 40s or early 50s, we lose one of those cells every second. 86,400 a day brain cells. When Alzheimer's disease destroys these cells, they cannot be reproduced and can cause dementia with tau or another form of protein that can clog them up. And so these are some of the things that people have to consider. What are the facts and figures about the form of dementia known as Alzheimer's disease? Almost 6 million Americans today are afflicted with this disease. Please understand, it is a disease of the brain, not of the soul. Sometimes people will say, well, they're just not trying hard enough, or they're being that way because they want to be that way. They're just trying to be argumentative. No, it does destroy the brain process and the ability to work in ways that it needs to be. Alzheimer's disease affects women more than they do men. For the almost 6 million Americans who have this, a little over half are women, and then the other part are men. A woman in her 60s has a 1 in 6 chance of developing Alzheimer's disease. Dementia comes from a Latin word meaning out of mind. It is the permanent loss of multiple intellectual functions. It's like a computer where the hard drive is crashed. The files are there, but they cannot be pulled up. It involves the loss of memory. In fact, often dementia is seen in attacking that part of the brain first. And then there's problems with speech and with understanding. Sometimes when you're talking to a dementia patient, you may ask the question, do you know who I am? Well, first of all, that's really not a good question to ask them. But secondly, it's going to take them 7 seconds longer to process that question if they're able to answer it at all. Dementia also includes a change in personality and behavior. Some people become more bitter when they have dementia. Some become better. They're easier to deal with. Sometimes people become hostile. Have you ever known a person who may have been a good religious person, a good neighbor, a good person, who all of a sudden begins to curse and swear like a sailor? That's because the brain has been damaged on the right side of that brain. And those brain cells called inhibitory circuits are damaged. And thus, there's no governor there to hold back from saying or doing improper things. Understand, it's the disease that's acting up, not the person itself. With dementia, there's also amnesia, the loss of memory function. People cannot recall things. They may sometimes even fake things by saying, well, you know the answer to that, and ask somebody else to answer it because they can't answer it themselves. But sadly, it just affects that portion of the brain. And then there's aphasia, the loss of ability to understand the spoken or written word. Remember I said it takes 72% longer for them to do a command that you request or to answer a question for them. Sometimes they may repeat the phrase over and over again because they hear the word, but they can't understand. What do you mean, spoon? What do you want me to do with this spoon? And then there is agnosia, the inability to recognize what things look like or feel like or who someone is. You see, dementia kills brain cells that allow them to see, but they can't recognize what a spoon is or what the command really means for them. It can also affect your appetite and your sleep. In dementia, there is a situation referred to as sundowning, where sometimes those with dementia sleep in the day and then they wander around at night and become agitated at night. There are various forms of dementia. Some have said there are as many as 80 different kinds. The number one form of dementia is Alzheimer's disease. If dementia is the last name, then Alzheimer's is the firstborn son. There are other kinds. Typically, with this kind of dementia, it lasts about 7 years before a person passes away. There is no cure for it. There is Lewy body dementia that involves Parkinson's disease. And then there's vascular dementia, which is the second most common. It's a lot of intellectual losses. People are up and down. Sometimes it involves mood swings and sometimes strokes. And then there is frontotemporal dementia, extremely progressive, where there are social and language problems. A lot of young people tend to have this, where they're out of control, acting inappropriately, and doing things of that nature. Just we need to understand exactly what it is and how devastating it can be. Let's talk about now for a few minutes diagnosis and treatment. What can a person do when they think someone is beginning to have mental issues? Well, first of all, you need to go see the proper kinds of doctors. Your regular doctor will often send you to a neurologist or a doctor that deals with those kinds of brain issues. And it's important that you get the proper diagnosis. Some research shows that half of all Alzheimer's disease cases and brain diseases go unnoticed because someone says, well, they're just getting older, and therefore they don't get a diagnosis. Some 9% of patients that show dementia symptoms can have reversible conditions. It was a thyroid issue or excess fluid on the brain or maybe a vitamin deficiency, especially B12, or maybe some side effects from meds. So it's really important that a person get the proper diagnosis. When you go to see a doctor, it's always important for 2 people to go. 2 is always better than 1. A lot of questions we ask by the doctor concerning the introduction of family. They may even ask the supposed patient to introduce who's with her or him. Questions about pain management, activities of daily living, what they can and cannot do. Are they driving? Work and education history, and the medical history. And then often the doctor will take the supposed patient by themselves and ask them a series of questions. We don't have time to talk about those, but in the workshop that we do about this, we talk about at length those questions that are asked. After diagnosis, after a person knows that a person does have dementia or a form of it, Alzheimer's disease or vascular or whatever, what do we do then? Well, first of all, we need to ask ourselves the question, how do we find our way in? What can we do to continue to communicate with this person who still loves us, who still hopefully may know us, and they also know that something's wrong with them? What are their pillars of personhood? That is, who is this person? It's important for you to let the doctor and those that are treating your loved one, whether they are at home or whether they are in an assisted living or whether they're in a nursing home or even a place especially for dementia, to let them know who they are, what they are important, and why they are important. Next, you need to use it or lose it. What can be done to help stimulate the brain and create blood flow to the body? When you're working with a dementia patient, one of the magic words is let's. Let's sit in this chair. Let's move around. Let's get up and go here. Social stimulation is imperative to keep one going. So always important to ask questions that can be helpful to them. Spiritual exercises are always important. Studies have shown that sometimes when people can't even remember who someone is, they can still remember the Bible, church songs, art, and the ability to sing. It's always important for a dementia patient to be able to sleep as well as possible. 7 to 8 hours of sleep are mandatory for good health. Interaction with friends and family are so important. We don't need to think, well, I just want to remember them the way they were. You know who they are. They may not know you, but you know them. And so it's important for family to be there. Teepa Snow, Teepa, who is an expert in the field of dementia, makes the point, if they can do a piece of the puzzle, let them do it. In other words, the things that they can do, tie their shoe, brush their teeth, pull their pants on, whatever the case may be, let them do it as long as they can. If they can sweep the floors, if they can fold clothes, look for things that they can do that they can succeed in. Don't worry about the product, but focus on the process. And with dementia patients, the difference between 2 choices and none is significance. Think about the independence they've lost. So you may say, do you want to wear this shirt or this shirt? And then most people, even in dementia, will respond to touch in a positive way. But touch them with them being able to see you as you place a hand upon them or an arm around their shoulder. When behavior of a negative nature is triggered, you need to ask the question, why? Did something change in their routine? Did something change in their life to cause this? There's a word that we would do well in the world of dementia to forget. And that word is remember. It is important that we lose that word as we talk to our dementia loved ones. Don't you remember them? Don't you remember me? Too many have said that is just like taking a hammer and hitting them upon the head. They can't remember. That ability has gone. And for you to try to ask them to remember when they can't makes them insecure, causing more anxiety, and erodes their self-worth. Think of the word R, A-R-E. And somebody has said, remember it this way. A, don't argue with them. R, don't reason with them. E, don't explain. They don't have that ability anymore. And so it's important that we love them for who they are. Mike Vestal, a preacher in Texas, was talking in a devotional one time at a nursing home where there were dementia patients. And afterwards, a dementia patient herself came to him and said, Brother Mike, I am so glad that you said we will recognize each other in heaven, because I can't remember anybody's name while here on earth. It's important for us to understand that. What are some things that we need to remember when caring for those with Alzheimer's disease or with dementia? Well, first of all, simplicity is the key. Regularity is the key. Expect that patient to ask the same questions over and over, and you have the patience to endure that. Expect them to follow you around. You may be their point of reference, and so you're the only thing familiar to them. That's why they continue to follow you. Give instructions one at a time. Rather than saying, now I need you to go here, and we got to eat here, and then we got to get in the car. No. Chop up those sentences one at a time. Don't raise your voice. That's going to scare or agitate them. But remember that because of this disease, it's going to take them 72% longer to process what you are saying to them. Therefore, be careful and give instructions one at a time. If a patient is at all resistant to what you're trying to do, to bathe them or to change clothes or whatever, then back off and come back later. That's important to do. Don't use baby talk. That's unfamiliar to them. And so we don't need to do that even in the situation that they're in. Try to maintain a sense of humor. One person put it, if all else fails, smile. Choices are often confusing. So at best, give them two choices. If a dementia patient is screaming, that's often an indicator of some type of pain. Perhaps take a dollar bill and say, Mama, if this dollar bill is an indication of your pain, then how much of this dollar bill are you in pain? Is it half? Is it just a small portion? Perhaps they can understand that. Allow dementia patients to awaken naturally, not abruptly. Make sure that the walkways and floors are clean and clear. Non-grip soles can help the patient who has a bit difficulty in picking up their feet to walk. We certainly don't want them to fall. Sometimes dementia patients in latter stages have problems turning around. Sometimes it would be helpful if their room is at the end of a hall. Sit with them when they eat. A patient who is sitting there unsupervised can sometimes be at increased risk of injury. Remember that tension is contagious. Use time out for yourself if you're a caregiver when needed. Get used to talking in short and kind, direct sentences. Remember that any change to a routine can affect function. Keep a list of what works with your loved ones and abandon things that do not work. And then be positive in words, in your looks, in your touch, and in your tone. Remember, they cannot help the way that they are acting, but you can. Make sure that you establish eye contact with the person. Don't come up from behind them. That can scare them. Approach them slowly and make sure that your tone is kind and not loud or scary in any way. Your body language could cause them to be frightened. Reach out and touch their hand while you talk to them. Be open to their concerns. Redirect if they're saying things or trying to be argumentative. You may have to even leave the room and then come back and try it again. Don't say, "Do you remember?" or "I told you so." Try to remember to look at the patient, that loved one, through dementia eyes. It's the illness that is talking, not the one that you know and love. Someone has said that there are 6 words in closing that we need to remember. I'm here, I care, anytime, anywhere. My hope is that something we've said today will help stimulate your thoughts concerning this. And if I can help you in any way, Dale Hubbard would be more than glad to get in touch with me. Thank you for listening.